The tummy tuck procedure aims to get rid of the excessive or saggy skin on the stomach area. So this excessive skin can happen or can result from significant weight loss or following pregnancy, which tends to stretch the skin and can leave overhanging or loose stretch mark. So the tummy tuck, basically, the tummy tuck, we remove a certain degree of skin, could be just the lower abdomen, could be the whole lower abdomen or all around the lower body, cutting that skin, tightening it, and at the same time, quite often we do repair of the muscle diastasis, which is the weakness of the muscle, which results from pregnancy. In my practice, most of the tummy tucks I do is I combine it with liposuction. So the liposuction aims to get rid of excessive fat tissue or fat deposits in the stomach area or on the flanks, and that helps the contouring of the body at the same time. Tummy tuck traditionally or by itself, it doesn't always involve the removal of the fat tissue, but when we call it lipoabdominoplasty, that means we combine it with liposuction. The pain after a tummy tuck procedure depends on many factors. So first, whether the muscle diastasis was repaired. Secondly, if local anesthetic, if the surgeon used local anesthetic or not. And thirdly, is whether the patient takes their painkillers or not. So when I do my tummy tucks, I do repair the muscle, but at the same time, I inject the muscle and the skin with local anesthetic, which is numbing solution. So when the patients are awake, especially the first 24 to 48 hours, they're not in a lot of pain. And as long as the patients take their painkillers on a regular basis, most of my patients, they say the pain is about 2, 3 out of 10. But if patients do not take their painkillers, then the pain can be quite severe. It could be 8 or 10 out of 10 if patients or if local anesthetic wasn't used. Yes, so the results of tummy tuck are permanent, provided the patient would lead a healthy lifestyle. They don't put on weight or have big weight fluctuations, because once the excessive skin is removed and cut, then the outcome is permanent for life. Statistically speaking, tummy tuck, it's one of the procedures which has significant risks, because there's a list of risks which can occur with this surgery. So starting from wound breakdown, infections, delayed healing, but also it's associated with clots in the legs or lungs, DVT, and it does carry with the risk will increase if it's combined with other surgeries, and the more you combine procedures together, the higher the risks. But if there are measures which we do to reduce those risks. So, for example, to reduce the risk of clots, there are compression stockings which patients need to wear. There are compression boots that we use in theater to reduce the clotting of the legs. And in my patients, I do prescribe a course of blood thinning injections after the surgery to reduce the risk of DVT. So once all the measures are taken in place, it doesn't make the tummy tuck any riskier than any other surgical procedure. Good question. So a good candidate for tummy tucks is a patient who has excess loose skin on the stomach area. So it can be either patient who lost a lot of weight or somebody after pregnancy, after giving birth. Now, there are patients who will have a higher risk of problems and they're not good candidates. So, for example, patients who smoke, patients with very high body mass index, if they have a lot of overweight, this increases the risk of complications. So they're not ideal. So my patient asked them to stop smoking. Now, high body mass index is not only increases the risk, but they don't get a good outcome from the surgery because of the internal visceral fat. So ideally, the best patient for these patients are patients with a body mass index between 18 and 25, maximum up to 30 body mass index, non-smoker, fit and healthy, and with some excessive skin, possibly a bit of fat on the abdomen.